Only care and caution will protect the gains that we have right now. If we are very careful, we can imagine a much better summer. And a better summer is the payoff from the stay-at-home order and the vaccinations. But if we let up, we will, with little doubt, lose the gains that we've worked so hard for. The best analogy is a minefield. Case rates are down, and the extended stay-at-home order in the GTA has been a powerful protection against more rapid growth. But the first dangers are immediately in front of us. Case rates are already rising in some of the public health units again. The new variants of the virus that first appeared in the United Kingdom, South Africa, and Brazil are another serious hazard ahead of us. In the United Kingdom, cases tripled in a month before much more severe lockdowns brought them back under control. Big jumps in mobility or big increases in gatherings will create the same kinds of dangers for us. Cases will likely explode if the virus gets into conditions that create superspreader events. And traveling across the province, from high-risk communities to low-risk communities, can ruin the gains in those public health units where the pandemic is already under control. Simply, we need to watch our every step. There is no easy path through a minefield, just care and caution with each step. I want to emphasize that this applies across all of Ontario, whatever the local public health measures are. We are no longer under the same rules everywhere, but we are still facing the same threat. An outbreak in one public health unit can easily cross the road to the one next door. It is easy for the virus to move between towns if people are moving. If the experiences in the United Kingdom and other countries that struggled with the new variants are any indication, any part of the province can go from a good situation to a bad situation in a matter of a few days. Indeed, we've seen this exact situation play out here in the past few days in Canada, in the province of Newfoundland, and right here at home in Northern Ontario. It's days, not weeks. Care and caution are particularly critical for our health system, for the health of the people working in our system, and for our ability to care for all patients in Ontario. Intensive care units, the highest level of bed that we have, still have more than 300 COVID-19 patients, and a rapid increase in COVID-19 patients in one public health unit can hamper care for all who need it there. Now, a better summer is in sight if we work for it now. The December lockdowns helped keep infections out of our long-term care homes, and prioritizing vaccination in these same homes protected their residents. Together, these changes likely saved more than 300 lives alone between December 14th and February 10th. We can save more lives, further reduce hospitalizations and intensive care unit admissions, and keep kids at school if we remain cautious and if we keep focusing our efforts where they will have the biggest impact on hospitalizations and deaths. Slipping now will have grave consequences. Readiness is all. Finally, before we get into the data, let me emphasize why the next few weeks are critical. COVID-19 is still here, and the proportion of the variants of concern is increasing. Vaccines are coming into Ontario, and we're able to move towards more and more vaccinations. Multiple, rigorous, and published studies show that these are safe vaccines with a high level of effectiveness, and the ones we have do provide protection against the new variants. But we have to give the vaccines time to work at the population level. We all know that the new variants spread more quickly than the old variants. We need the next few weeks to understand how the variants are actually changing the pandemic, especially with schools open. We also need time to roll out vaccines. The next few weeks will give us a map through the minefield, but we cannot afford to rush through the minefield before we have that map.